Okay.
All right. So this, guys, is the best midwife in Atlanta, and I don't lie. I just don't. This is
Thank you.
Missy, and she's a home birth midwife, and I'm gonna let her tell you about that world, and you can see why she is the best midwife there is.
Mhm. Well, thank you. Um, what I was saying was there are a lot of different kinds of midwives out there. There are your typical, you get a 15-minute visit, you're in and out, didn't really get a chance to have your questions answered, but you think everything's okay type visits. And then there's the type of care that I provide, which is more of a holistic midwifery. So I was trained by both a nurse midwife and a traditional midwife, and I have a degree in midwifery. So I got all that medical knowledge, but also got the art of midwifery, which midwife means with woman. So our visits are about an hour long. People bring their kids, they bring their partners, or they come alone. We have hot tea and healthy snacks available. We sit down, we talk about how life is going, what you're eating, how you're sleeping. And then we do all the medical things too. We take your blood pressure, listen to the baby, measure your belly, things like that. But the visits are longer because it's the whole person that I'm looking at.
And that's huge. That's really important. Now, are you going to their homes or are they coming to you?
They come. I have an office in my home, and
Mm-hmm.
so everybody comes here. People's kids like to feed my chickens when they leave. There's
Yay!
toys everywhere, and it's centered for the whole family, centered on the woman, the person having the baby, but comfortable for the whole family here. And then, of course, when they have the baby, we come to their house for that.
Awesome, awesome, awesome. And where can people find you if they are interested in, connecting with a midwife, if they're interested in
Uh-huh.
having a home birth?
My website is homegrownbirth.com.
Okay. All right. Are you on Facebook?
And then my Facebook is Missi, MISSI. Yeah, Missi
MISSI?
Burgess.
Hmm.
Mm-hmm.
Okay.
Yeah, Missi
All
Burgess, CPM.
Okay, awesome,
Yeah.
awesome. And now, for anybody who is catching this and wants to know why they should have a midwife, what would you say to that?
I would say the most moving reason is because Georgia is the worst state in the entire nation to have a baby right now. Our maternal mortality is the highest. Our infant mortality is one of the highest, especially for women of color, because their needs aren't being met. They're not being listened to. They're not being cared for. And studies have shown that midwives can reduce the maternal mortality rate by 80%
That's
because
huge.
of what I said, because we're taking the time to sit with a woman
Yeah.
and walk through her life with her. And we're not just meeting the clinical need, but we're meeting spiritual and emotional and physical needs as well. And educating the woman, because women should be able to own their own health. They should be in charge. But if you don't give them the information to make those decisions, they can't make those decisions. But when you give a woman the right information, she's going to make the best choice for herself and her baby, and they're going to live because
Hmm.
of it. So midwives stand beside women to empower women to be able to do those things. Um, and we need more midwives, and women need more access to midwives.
Yeah,
But
that is
yeah,
true.
that's my main reason right there is
That's
giving
so
the control back to the women.
true. Mhm. How often do you typically see a mom during her pregnancy?
We follow the standard prenatal care guidelines, same that OBs and hospital practices do. So we see them monthly until they're about 7 to 8 months, and then we see them every 2 weeks
Hmm.
until 37 weeks. We do that visit at the woman's home,
Okay.
just so we know they're set up for their birth, we know how to get there, all of that kind of stuff, and then we see them weekly until they deliver after that.
Awesome. That's pretty awesome. And when would you recommend, if the mom is pregnant, when would you recommend her reaching out to the midwife? The same time as she would with a regular OB?
Yeah, because we're doing home birth. that means that I'm only paying attention to one person in labor at a time. That's
Mhm.
another benefit of home birth midwifery care, is that we're not on a labor hall. We're paying attention to a lot of patients at a time. We're just with that one woman. So that limits the number of women that I can take that are due in a certain month. Because I want to make sure everybody's getting good care. I'm not going to take on too many. So one part of that is logistical. You want to make sure that the midwife that you want has room for you
Mhm.
in her calendar for that month. And then the other part of it is just specific to care. Women need to start care between 10 and 12 weeks.
That's awesome. That is absolutely awesome. So baby number 3, if baby number 3 comes, I will be calling you. We will be getting
Please
a
call
home birth.
me.
We will be
You're a
getting a
good
home birth.
candidate.
We may need to document the journey, but we're not calling baby number 3 yet. Not just yet.
That's fine.
Whew, we need to wrangle baby number 2 first. He's got a lot of energy. Oh, that's awesome. I think that a lot of people could benefit from that because again, I feel like you're right. The the stats came out earlier this year, and I know nationwide they were saying that, African Americans were 283% more likely to die during
Yeah.
childbirth, which is outrageous
Yeah.
here in the US.
Yeah.
And I, we can talk, and call any number of reasons, but ultimately, and I've heard it from, women of color, women of all different races, they just don't feel like they're heard in most
Right.
hospital-based systems. And don't get me wrong, there's some good OBs out there, and there's some good,
Yeah.
there are good experiences that people have had. But that being said, across the board, it seems like there is a huge concern
Yeah.
with regards to this in our specific community here in Georgia.
Yeah.
So.
The system is not set up to benefit the woman. It's set up to benefit the system.
Mm-hmm.
And we get, I had all 5 of my babies at home with the same midwife, and never understood how fortunate I was to have that experience until I started working with women. And I get so many moms that are on their second or their third pregnancy, and we spend a majority of the time just working past the trauma of what happened with the first baby, with that birth or with the prenatal care or whatever. And then give the hope is to give her a healing experience with her labor and birth of the current baby that we're on. And that happens a lot, but my hope is that we get to the point where people don't have this trauma with the first one, that they're able to have good experiences having their babies. Because when you look at our statistics, we're not okay. This isn't working out well for women or babies the way that we're doing it right now.
Yeah, and that's, and I see it a lot too as a pelvic health therapist with a lot of women that are coming and they have the birth trauma. I mean, to the point where in some cases it's so severe that they completely dissociate, like nothing exists below their belly button,
Right.
except for probably their knees and their ankles. They completely dissociate, and they have because going back is so painful, and in the amount of time that you spend just trying to get a mom to reconnect. I mean, which is really beneficial for them, but it's heartbreaking because nobody should have to go through some of the things that I've heard some women go through, and I'm sure that you've heard as well. So
yeah. I used to think they were conspiracies because most of my friends had home births, and I was having home births, and so I was hearing these things. I'm like, no, they're not really doing that. And then when I became a doula, I saw it with my own eyes, and it was just unbelievable, the things that women are asked to go through when they're pregnant and giving birth, of all times, to have to fight with someone.
It's rough. I mean, with my daughter in my hospital experience, I had a nurse come to me, and I'd already told him I didn't want any pain medication because I was, I was fine. I wasn't in any pain. And I had a nurse approach me. She's got a needle, and I'm like, what is that? She's like, your epidural. Said, I beg your pardon. And she's like, well, you're going to need it, but I didn't ask for it. Well, you're going to need it. I'm like, look, lady, I don't know you from Adam, and I'm going to blame it on the hormones, but if you bring that thing close to me, it's not going to be pretty.
Right.
I mean, she didn't approach me. She didn't talk to me. She didn't ask me how I was doing. She didn't say, hey, here's something that we recommend, because I think that's all in the delivery too. Here's something we recommend, but you have the option to decline. Nothing of the sort. You're just coming at me with a needle. And it's like,
well, we don't bring we don't bring epidurals to home birth, but we are able, I think this is the thing that a lot of people don't realize, is that we provide complete prenatal care. All of the normal labs and tests and things like that that your average obstetrical care provider offers, the home birth midwives offer those too. All of those tests. We're just not going to force them on you.
Yeah.
And same thing for all the routine things for the newborn. We offer all of those, but it's your baby and it's your choice if you want the vitamin K injection, or you want the ointment in the eyes, and all of those things that we're trained to give them. And but it's your choice. You're not going to force anything on anybody. And there's a lot of conversations that happen because we have the time to do it. Because hospital providers don't have the time.
They don't.
They've got 8 other people laboring at the same time or whatever. So yeah, I think that's important for people to recognize that we can offer all those things if you want them.
If you want them.
Yeah, but it's a collaborative decision.
Yeah. How long after the birth do you see the mom?
Well, we stay for 2 to 3 hours in the immediate postpartum because we do the newborn exam, and then if a mom does tear, we suture for her, as long as it's not too extensive. We're not going to do like a 4th degree tear at home. And then once everybody's stable, we go home. We come back in 2 days. We offer all the standard newborn screenings: the hearing screen, the metabolic screen, which is the heel poke. And then there's a cardiac defect screening that we do with a pulse oximeter. And then our care is set up to last for 6 weeks. And some of the home birth midwives will even do pap smears at that point. If a woman. Yeah.
Who needs GYNs? We should just all have our personal midwife.
That really is how it should be. It should be for the lifetime, for a woman's lifetime. I mean, that's what we're trained to do. We're skilled in that. We're the best person to offer that, to be able to care for a woman throughout all of her life cycles.
Yeah.
It's ideal.
I think there's so much to be said for maternal care and gynecological care. I mean, even on my end as a pelvic floor therapist, a lot of the things that we see with women postpartum, and you see them after the fact, and they go, for instance, I had a mom recently that she told me, I went to my OB and they never recommended therapy, but I'm still having pain. And she was referred by someone else that knew me. And she was like, I didn't know all this was like a thing. I'm like, yeah, you're not supposed to be in pain. And, I really wish, my hope and dream is that ultimately that will be the standard of care, that women will be educated enough and informed enough that will be the standard of care, that after you have your child, you have your pelvic floor therapy, and you make sure that you're okay, because we're so hyper focused on the baby, which, I mean, that's good. We want the babies to be okay, but then we lose sight of the moms. And if you don't have a mom in good shape, then that mom can't take care of that baby and keep that baby happy. And so we need to do better as a community of taking care of our moms.
Yeah. Typically a woman is not seen until 6 weeks. Like there's not even any contact. There's not an opportunity to ask a question or say, I have this concern. And so that your typical home birth midwife, if she's not seeing the client at a week, she's making a phone call. If she's not seeing the client at 2 or 3 weeks, she's making a phone call. And some of that also depends on a person's health history, their risk factors. There's some people that I want to see them at 3 weeks and at 6 weeks and maybe at 4. It just depends on if it's a first time mom or what she's got going on. Because then sometimes we have, home birth attracts people that have had a lot of kids. And so, they're on their 5th baby. They don't really have time to come and see me 3 times. So that's going to be a phone call. Things sound good. We're good. We're just going to see you at 6 weeks to wrap it up, that kind of thing. But we're able to cater our care more individually to what people need.
That's awesome. That is awesome. Well, guys, I told you she was the best. So if you are pregnant, considering being pregnant, you need to consider having a midwife, and more specifically having a home birth midwife, because I think that individualized care is phenomenal. And if once you've had it, you're going to keep wanting a midwife. All right. Well, thank you so much for that. And guys, if you need Missi, you can find her on Facebook, Missi Burgess CPM, or you can go, what's the website again?
Homegrownbirth.com.
Homegrownbirth.com. All right. Thank you so much.